Hi, this is a presentation brought to you by Dr. Travis McDonough and Vericle. Vericle has made a very strong commitment to their client base to offer a plethora of services that can be leveraged by their client base, again, to engage, activate, and educate their patients that they serve. Today we'll be focusing in on a program called 3DRX Comply, which is a world-leading patient activation, education, and engagement system. The reason why patient education and engagement through this type of technology is important is because the average patient retains less than 7% of information that gets delivered through traditional methods of communication. Oftentimes we leverage medical nomenclature and terminology that can bamboozle a patient and confuse them rather than activate them in their care. So we've created, again, a giant library of digital assets that are depicted with 100% accuracy, and we can communicate through this rich digital media to provide a patient with a much more enhanced understanding of what is wrong with them and what they need to do to, again, participate in their own recovery in this situation. So yes, the statistics are alarming in this space. Again, the average patient retains as little as 7% of information delivered through text or verbal explanation. And that seismic gap between what is told and what is understood has enormous implications in low patient engagement, poor satisfaction, lack of adherence to a treatment plan, and poor outcomes. So what we're showing you here is, again, the easy-to-use system where it's simply point on a body part that you want to educate your patient on, then simply select the condition that they might be suffering from. Again, you can see the graphical nature of the tool that comes along with supportive text that you can modify and change. The step 2 would be to click on the treatment, and the treatment you can simply select on the treatment that you would like to administer, and again, supportive text comes up. And then there's a treatment and frequency calculator that will very transparently let the patient know how many times you feel that you will need to provide a treatment, which again is crucial for patient engagement. You can see the large library, again, of tools that can be used to educate your patients on. Step 3 is moving to the rehab section, where there is an enormous library of rehabilitative exercises, partially in video and partially in pictures, where simply by clicking on the tab, quickly and efficiently, you can load the exercise of your choice that goes into the patient's report that can be sent directly through the Vericle platform and program. You are also able to set up through the administration area your own protocol templates through rehabilitation, which is very, very effective. And finally, you have some ancillary supportive tools that you can select that you can educate your patients on, or recommend that they purchase and acquire something to provide them with, again, some supportive care around their ailment. Before I get to the report generation, I'm going to walk you through another couple of examples to show you how easy to use and intuitive the tool is. So simply click on the body part that the patient has the injury in. You simply select the type of condition that they have. In this situation, we're seeing a acromioclavicular sprain 3, and you might also want to show them a lesion that has occurred in their labrum, and you can see that here. And you also maybe would like to show them how through instability in their glenohumeral joint, you're seeing sort of an upward migration of the humeral head, which is impinging the fluid-filled sac called the bursa, which leads to further complications. You can see the supportive text over here, and you're able to use those. And you're also able to draw on the tool as well if you would like to highlight any features. Next would be what treatment you're going to administer. In this situation, I've selected electrotherapy, which you can then select your frequency and duration of treatments. Following that, You can move into, again, an enormous library of rehabilitative exercises where you can simply quickly load the exercise or click the thumbnail, which will bring up a before and after picture, again, that you can highlight and draw text on. Finally, you have the ability to offer or show them whatever other features and functionalities and products that you feel that they need to expedite their care. And last of all, you're able to generate a report by clicking the Send Report tab up in the top right-hand corner. The nice thing between Vericle and 3DRX is you see there's an auto population here, so the patient's file gets automatically deployed inside this report generation tool, where you then can simply go down and you are able to select what report you would like to send and which thumbnails and which images, and by simply collecting the view report, you're able to deploy this report into the patient's inbox, so they're actually able to receive this very detailed and graphically pleasing report upon the completion of their first appointment or any follow-up appointments. It's a very, very important tool, again, for a series of different reasons, but there's been a lot of strong research showing that it dramatically reduces the amount of patient cancellations, which can be the #1 financial hemorrhage in a physical therapy and chiropractic setting. It also leads to a much stronger adherence to a treatment plan, which is crucial to also get better outcomes and have better patient satisfaction, which is very, very important for the stimulation of referrals, which is the lifeblood of private practice and public care as well. So yes, if you would like more information on this very intuitive and education friendly tool that can activate, engage, and educate your patients more thoroughly and more effectively, please contact the Vericle office and your representative, where they can walk you through this program, and you can start to use it inside your care for getting better results and keeping your patients happier and more satisfied. Thank you.